So yes, I'm Natalie Hilliard. I'm a physiotherapist. I'm here today with Dr. Michelle Bull, who is also a physiotherapist, and we are co-founders of Physios for ME here in the UK. So hopefully today we're going to talk about understanding and managing ME CFS for physiotherapists. Next slide, please, Michelle. Thank you. Okay, so as Physios for ME, just a little bit of background, our journey so far. We are 4 like-minded physios, all with personal and professional experience of ME. We all met kind of at the same time virtually, and Karen, who is another member, and I met at an ME conference back in 2019. And then Nicola came along, Dr. Nicola Clegg-Baker, she came along as well. And we all kind of established this connection. And we all knew that people with ME, people close to us, and patients were experiencing very, very poor treatment by physiotherapists. And we needed to change this. So in 2019, Physios for ME was founded. We are a voluntary organisation, and since then we've done a lot, we've achieved a lot, but we do know there's still a lot more to do. Our key objective is to research, educate, and advocate to improve physiotherapy management for people with ME. First of all, because the audience may be varied here, I think just a little bit of background on what we actually do as physiotherapists. You probably all know, but just in case, we basically look at the whole body. We don't just look at individual aspects of an injury or illness. We use holistic approaches. We do a lot of education, a lot of advice to other physiotherapists who are learning, and it's a big part of our job. We also, obviously, because we're physiotherapists, we do movement, we do exercise and physical activity advice. So we may often give exercises to improve general health and mobility and to strengthen specific parts of our patients' bodies after, say, an injury or illness. And of course, we use our hands, where hopefully we help to relieve pain and stiffness and to encourage better movement of the body. Physiotherapy as a profession does a lot more than that, but as a general kind of introduction to physio, that is what we do. What we also do is, within our approach, we have a sort of set idea of how we help our patients. We will do a subjective assessment. So we talk to our patients, we ask what the problem is, we look at their medical history, we want to understand what the problems are. Then we'll do a physical assessment. We will measure muscle strength, we will measure range of movement of a joint, we will look at endurance, we will measure stiffness in joints. There's all sorts of physical assessments that we do. Then together with the patient, we will devise a treatment plan. So how are we going to help this person, whatever their problem might be? How are we going to work together to get a good outcome? And then part of that practice is that we will evaluate what we do on an ongoing basis. Is it working? Are we helping the patient? Do we need to change what we do? This is important because it's sort of, as we go through the presentation, Michelle will look back on this and look at physiotherapy helping people with ME. But this is our basic way that we treat patients. So why are physios getting it wrong in ME and CFS? We knew that anecdotally people with ME were experiencing poor physiotherapy treatment. So what we did when we first established in 2019, along with the ME Association here in the UK, we put a survey together to find out a little bit more information about what was going wrong in physiotherapy. We did a poster presentation of the results, And if you look at the sort of the red line, the red circle, what that shows in our survey was that 54% of people with ME had a negative experience of physiotherapy. 53% said symptoms were worse after physiotherapy. 70% said that even if they had a positive experience, it still didn't help their symptoms. With this kind of data in any other physiotherapy patient group, this would not be acceptable. We'd be thinking, why are we not helping these people? We need to do something. Something's going wrong. But sort of the historical nature of ME, I think we all understand why it was going wrong. And we'll come on to that a little bit later as well. But a lot of the feedback in the survey were things like, my symptoms increased during the physio course. I'm deeply disturbed by the level of prejudice, negligence and dishonesty. The physio refused to manage risk and refused to report adverse effects. They said I was uncooperative and non-receptive to treatment. These are the types of comments that we were hearing and the comments that we knew, and we needed to do something. So the question was, why was it going so wrong? What we did, because obviously what the presentation is about today is about education. So we kind of gleaned that the fact that things were going so wrong, we knew it was because of a lack of education. But again, we needed to look at what was going on in universities. Why were physios coming out of physio school and not understanding ME and causing harm? So with the support of our Chartered Society of Physiotherapy, we sent out a survey to all university schools, any university that was doing physiotherapy as an undergraduate degree. 56% of schools responded to the survey. Of those who replied, less than half included ME in their curriculum. And those which did include ME only spent between 1 to 2 hours on the disease within the 3-year course. And the type of information taught was inconsistent between the courses. So you can see the reason why physiotherapists were not really understanding ME and why treatment outcomes were so poor. And the reason it's important to understand this is because already qualified physios who had no experience or no training of people with ME were probably seeing people with ME in other specialities, including pediatrics, community physiotherapy, musculoskeletal physiotherapy and neurological physiotherapy, and would not have understood what was going on, what they needed to understand about people with ME. They had very, very little or knowledge or none at all. They wouldn't have understood that treatments needed to be adapted, even if they were not treating the person or treating the person's ME directly. So this is why this was really important to try and understand. Next slide, please. So just a little bit about understanding ME and what physiotherapists actually need to know. Fundamentally, they need to know that ME is a complex multi-system condition affecting multiple body systems. They also need to know it's a fluctuating condition. It can be relapsing, remitting, it can be progressive, it can change between different levels of severity. Physiotherapists really, really need to understand this. They also need to know that there are different levels of severity, from mild, moderate, severe to the very severe end of the spectrum. They also need to know that the hallmark feature of ME is post-exertional malaise. That slide's not quite come up, Michelle.
I'll go back and then try again.
No. Try again. That's it.
Okay.
So, perfect. So what is post-exertional malaise? Again, some of you in the audience will understand this and know, but for those who don't, post-exertional malaise is a rapid physical and or cognitive fatigability in response to exertion, which can be triggered by minimal activity. It can be debilitating and it can cause a relapse. There is also part of it, something called post-exertional symptom exacerbation, which means that already present symptoms are worsened during times of exertion or after exertion. And this is the really important thing to understand about post-exertional malaise, is that it can occur immediately after activity, but it can also be delayed the next day or the following day or the day after that. And recovery from this symptom exacerbation can usually take 24 hours or longer, but a relapse can last days, weeks, or longer. We know there's a low threshold of physical and mental fatigability, and this can result in a substantial reduction in pre-illness activity. Next slide. And I think significantly, what PEM or post-exertional malaise, people need, or physios need to understand, it's not just fatigue. It's all of the things listed on the slide, plus more. I think one of the research showed something like 200 different symptoms of PEM. Physios really need to understand this so they can monitor their patients for these symptoms and these flare-ups. And they also need to know that PEM is delayed and can persist, because often they won't understand this. Next slide, please. Over to you, Michelle.
Thanks, Natalie. So what causes post-exertional malaise that Natalie's just described? Well, I think the answer is we still don't entirely know, but we've got some indications that might help us understand what could be causing it. Nina mentioned exercise, and one of the things that we know regarding ME is around the use of the cardiopulmonary exercise test, CPET test, which is looking to see how efficient the energy system is working, and also looking to measure, gives us these sort of markers, if you like, of how well the system is working. And we look at the VO2 max and the ventilatory anaerobic threshold. I'm not going to go into sort of the whole ethos behind CPET testing, but just wanted to mention that because we know from looking at tests, looking at research, that basically there is a difference in a response to exertion in people with ME. So they had that lower VO2 max, so they're switching to that, using their anaerobic metabolism earlier than others, and also higher production of lactic acid. So we can see that people with ME are entering that anaerobic metabolism, which isn't very efficient and also isn't very sustainable at a much quicker rate than those without disease. So we know we're getting an abnormal response to exertion. And we put together a slide on our Physios for ME website, trying to pull together all the research. And we've probably got more now that we need to add to this. But I think the key message is around the fact that predominantly a normal response is not what is seen in people with ME. And to reiterate the point made by Nina, this isn't deconditioning. This is an abnormal physiological response. So we shouldn't be looking to try and recondition a person to try and solve this. So what does this mean for us as physios in practice? Well, there's sort of three things that I'm going to touch on. We need to screen for post-exertional malaise. We need to be very careful to avoid causing post-exertional malaise that do no harm. And we need to adjust our activity and our exercise advice. And that's for everything that we might be doing as physios. So not just if we are focusing on the ME, but whatever we are doing when we're working with somebody who has ME. And it's really important to have, as physios, to have that knowledge of these abnormal exercise physiology. And more and more now we're seeing that, as Nina alluded to, in long COVID. Now, for us as physios, this is a really different way of thinking about physical activity. We are really used to thinking that physical activity and exercise is good. It's one of the fundamental tools in our toolbox. And we also know that there's a lot of, when you look at risks and benefits, that it's safer for people with long-term conditions to be physically active, that actually the benefits outweigh the risks. But we worked with with Sport England as they were putting together this advice, and we managed to get them to include ME, chronic fatigue syndrome, in this guidance because we know that we have to do it differently. But that's a big ask for us as a profession, to start thinking differently about something that has been so fundamental to us in how we do our job. So similar to what Nina just mentioned, how do we screen for PEM before we start? Well, I'm a great believer in just asking questions, but we do have the validated questionnaire. That's the DePaul symptom questionnaire. But it's basically as simple as asking a person about their physical activity, their mental and cognitive activity, and their emotional and social activity, and what they are like a couple of days after. And it's also really important at this point not to do any of the physical tests that we might normally do as a physio to give us a baseline. We shouldn't be trying to put somebody who's suggesting that they get PEM through 6-minute walk tests and 6-to-stand tests, sit-to-stand tests. So again, it's asking us as physios to work in a very different way. And there's some great research that our friends and colleagues over at the Workwell Foundation have done around screening for PEM, which shows that literally just asking the questions can accurately identify PEM. So all the slides are referenced, definitely worth going and looking there, but just ask the questions and ask how long it takes you to recover. So coming back to this slide that Natalie showed earlier, what do we do as physios? All these things we do can lead to PEM if we don't do it right. Asking somebody too many questions can overload cognitively, doing too much with our physical assessments, getting our treatment plan wrong, and not doing our ongoing evaluation. So we need to be really cautious, and we need to consider PEM as a sort of underlying approach to how we do our assessments. Can we break it up? Can we send any information out in advance so that we don't have to ask as many questions on the day? Adapting our physical assessment, and of being obvious as well around changing our treatment plans. We recently, our national guidance has changed and basically says that we should not be offering any therapy based on physical activity or exercise as a cure, and we shouldn't be using any generalized physical activity or exercise programs. Definitely not using fixed incremental increases in physical activity. So that's a big no to graded exercise therapy, and anything that's based on deconditioning and exercise avoidance theories is also not to be offered. And this is really positive, and I think there's a lot of campaigning from patient groups to get us here, but it's really positive. So what should an activity program look like? So we need to be talking about activity management and how we look at the overall activity that a person's using in their day and week. And I'm not going to go into too much detail here because I know we've got Amy talking later, and she's going to talk more about activity management and about pacing. We also might use heart rate monitoring to help us, and fatigue management. And I know Natalie will agree with me, we are big champions for restorative rest, that actually it's as important to rest as to do anything activity-wise. So that's a lot different to a normal physio approach. So we've had to work quite hard to try and get the message out there. So I'm going to talk a little bit now about our strategy of trying to educate our colleagues. It is work in progress. We have by no means, it's no means finished, but we've taken a sort of multi-stranded approach. We are doing podcasts and work on social media. We've used the COVID pandemic as an opportunity to raise awareness of post-viral illnesses. We've been undertaking some research, I'll talk a bit about that in a minute, and some training at undergraduate academic institutions, and also talk a bit about our book. So thinking about social media and podcasts, we've developed 7 slides for physiotherapists. This is just one of them that we use every ME Awareness Week, and we tweet out something different every day. We've also got Facebook and Blue Sky pages that we're using, and we try and make this very physio specific. So here you can see we're saying to physios, you might want to adapt your assessment. You might want to think about what time of day is right for patients. You might want to adapt how you approach the patient with the volume of your voice, brief questions. I know when I started working with people with long COVID and we were doing a lot of video consultations, I had to stop waving my hands around quite as much as I normally do because of that extra stimulation. So, as I said, you can find us on Twitter, or X as it's now known, but we also have a website where we use have a lot of this information, and we try and blog out updates. I mentioned we use COVID as an opportunity to talk about increasing the understanding of post-viral fatigue syndrome and ME, and we ran a series of podcasts and tried to get the message out into a lot of places to say, don't take the traditional approach if somebody is looking like they have signs of ME. And we had lots of positive feedback and lots of uptake of our learning opportunities, which shows that actually we could use online as a way to educate, but also showed that people needed to know and wanted to know more. And the feedback was really positive. Nina mentioned research, and we've been doing some research. We've had a couple of papers published, and we've got more poster presentations available on the research page on our website. One of the things that we've done an initial feasibility study on is around home-based testing. Obviously, CPET testing is great if you can get on a treadmill or a bike. You can get into a centre, but it's quite specialised, exercise related. We wanted to look at, can you test people at home and using portable equipment, and also what does that tell us? So our initial study just was looking at the feasibility of actually doing it, which was positive, and we are hoping to see how we can expand that now and look in more depth to actually do a full research study. And then we've also done an international survey around using heart rate monitoring for pacing. We're really keen that our research all looks at the impact of a physiotherapeutic intervention, understanding of the physiology of ME that will help us influence our physio assessment or management plan. Really keen to explore people living with ME's experience of physio and physio interventions so that we can educate with our colleagues and show how there is room for improvement, and also understand what physios actually understand and they're experiencing. So we do have several other projects planned, and we're hoping that we've got another publication coming out really soon. So keep watching and visit our website to find out more. We mentioned right at the beginning, Natalie mentioned about the undergraduate training, and we're developing a module that we can share. So Nina talked about how important to make sure that we're sharing the right information when we are educating people about ME. So we're putting this together and testing it with 1 or 2 academic institutions, and then hoping to share that more widely. And then the thing that's taken up a lot of our time recently is writing our book. We were really pleased to be approached by a publisher to write our book because we felt this was a great opportunity to educate physios working with any field of physio. And we've got a specific session on assessment, energy management, and how to basically what physios should be doing. And we've been really lucky that a patient with a severe ME has donated some money. And if you have a look on our social media or our website, you can see that you can actually nominate physio clinics or services to go into a draw to receive a copy of the book. So would urge you, if you know anybody you think could benefit from it, to do that so that we can include them in the draw. We do know, though, that we've still got a lot of work to do. We've mentioned targeting physio students. We need to spread the word to physios who aren't in specialist services so that they understand if somebody presents with a sore knee who has ME, that they have to approach their treatment plan in a different way to somebody who doesn't have ME, and they need to be able to consider that as a comorbidity. And then we also want to target physios working within specialist services to help them see how they might change their services and become more aligned to the more recent evidence. So that's a massive whistle-stop tour through what we've been doing to try and achieve our aims of research, educating and advocating to improve physio management. I've talked a lot about our website because you can find out more information there, and specifically highlighted the resources for physios, which is a good place to direct people to if they want more information. And I'm going to stop sharing my screen, and hopefully that's covered everything that you wanted us to cover. Unfortunately, neither Natalie or I don't think are going to be able to make the questions at the end of the day. So I don't know if there's any questions in the chat in English, because I can't read in Norway. Oh, there is one question. How many people? There's only 4 of us. And as Natalie said, we do it all in our spare time.